Dear learners, welcome back to NPTEL online certification course on novel drug delivery systems. I am Dr. Satish Devanapelli, Assistant Professor at Department of Pharmaceutical Sciences and Technology, Institute of Chemical Technology, Mumbai. In our novel drug delivery systems, so far we have discussed on various types of the novel drug delivery systems, and we are discussing the various types of drug delivery systems by targeting the organs. So far we discussed on the oral drug delivery, that is targeted to the gastric system, and then we have discussed on the nasal delivery as well as pulmonary delivery in the mucosal drug delivery systems, and also we have completed on the ocular drug delivery systems. So today we are going to target on one another the organ which is one of the most commonly used as in a targeted delivery systems. So today we are going to discuss on the transdermal drug delivery systems, and with this you understand that transdermal formulations comes under the category of the topical formulations, and here the target is the skin. So today we are going to discuss on the transdermal drug delivery systems. So here this is my flow of presentation. So in our first lecture, in the introduction to the transdermal drug delivery systems, we will focus on, we will try to understand what are the transdermal drug delivery systems. We will see the drugs used for the transdermal drug delivery, and also there are the patches which are available in the market. We just will focus on that. Then we will see what are the advantages, limitations and the ideal characteristics of transdermal drug delivery formulations, and we will focus on the anatomy of the skin, and we will see what are the barriers which are problematic in the delivery of the transdermal formulations. And also we will focus on the two topics which are about the percutaneous absorption and the drug permeation routes across the skin. So transdermal drug delivery systems is the one of the system lying under the category of the controlled drug delivery systems. So here we prepare the conventional topical formulations into the novel drug delivery system to control the release of the drug and as well as to reach the target site at particular time intervals. So we know that these conventional topical formulations have a limitations which cannot reach to the blood, so which cannot reach the required amount to show the activity. So the translation of the conventional formulation into the transdermal, which we can expect the drug passing through the skin at predetermined as well as control rate to reach the systemic circulation. Now here you can see the comparison of the conventional and the transdermal patches. So these are the application which we do, creams, ointment and gels and other type of formulation. So they cannot enter into the systemic blood circulation because of the skin barriers which are present in the skin. Whereas when used transdermal patches, by applying or by using of various formulation strategies and by taking the help of the various components which will enhance the skin permeation. So with that we can achieve the concentration of the drug in the blood by using of the transdermal patches. Now you can see the transdermal patches, so which can be applied on the skin. Now, these are the various therapeutic areas we use for the treatment of the diseases. So, these are the drugs which can delivered by the transdermal drug delivery systems. So, these are the various examples of the drugs, that is nicotine we use for the treatment of smoking cessation, to avoid the habit of taking of the smoking, and to control the smoking cessation, we can have nicotine patches that we can place it, so we can avoid the smoking habit. And as well as when you have the cardiovascular diseases, nitroglycerin and clonidine also can be converted into the patch that can be helpful for the treatment of cardiovascular diseases. And the fentanyl and buprenorphine, so which are the opioid analgesics which will help for the treatment of the pain. And we have non-steroidal anti-inflammatory drugs which can also help for the treatment of the inflammation by applying the patch. And also we have, there are the drugs, the donepezil and the rivastigmine can be used for the treatment of Alzheimer's, and the levodopa we use for the treatment of Parkinson, and the CNAs. And not only these, we can use various types of the drugs which helpful for the neurodegeneration, such can be translated into the transdermal patches. This is one of the most commonly used area in the transdermal, that is the hormone replacement or contraceptive medications by using the transdermal formulations. So, here these are the some of the marketed products. Now, here you can see the brand names and the drugs and the indication for that product, and also the manufacturer of the product. Now, here you can see that is a transderm scope. Here you can see in the picture, which is contain the scopolamine, which you can use for the motion sickness, and the company is Baxter, which prepared the transderm scope, that is used for the treatment of motion sickness, which comes in the dosage is 1.5 mg, and you can see the label claim the 1 mg over 3 days. So, with this you will understand how the drug will control the release. When people are moving from one place to another place, for it is a long journey or climbing into the mountain, such cases we can use the motion sickness formulations in the transdermal patches. Now, here is the nicotine, it is called as Nicodem, that you can see here. It is also, the label claim says that it is an extended release patch, and you can see which contains the 14 clear patches, and it is a 2 weeks kit, and we can use the one patch for 1 day. So, here also this is a treatment prepared by the GlaxoSmithKline, and also we have other the hormone replacement and other formulations which for the treatment of CNS, and the lidocaine and tetracaine will also be used for the various treatment options we have. Now, what are the advantages compared to other types of dosage, other types of routes of administration? Because self administration and easy, convenient. So, it is also mimic to the advantages of the oral formulations. The administration is very easy, and you do not need any practitioner, and it is very convenient for the administration by patient itself. And yes, this is a non-invasive, whereas parenterals and other ocular inserts, and you need some of the practitioners to help, and here there is no invasive, there is no injection as it is, just you need to place the patch, and you can avoid the all type of pain and the giving the injections into the skin. So, yes, with this we can also expect the continuous and sustained drug release. We have seen in our previous slide also, the marketed products suggest that which are comes in the category of continuous and sustained release. Some formulation work for 24 hours, another formulation working for 3 days. So, that is the greatness of the transdermal patches. Here we use various types of polymers and matrices that will help for the control release. Longer dosing intervals can work for several doses, already we have discussed, and we can bypass the all type of the problems which comes with the liver, that is a first pass metabolism, that is one of the major problem in the oral drug delivery. And also we can avoid all type of the ulcers and also irritation, drug degradation in the stomach, and because we are completely eliminating the oral route. Better patient compliance due to less frequent dosing, you no need to take, just put the patch for 24 hours and 48 hours and it works accordingly. There is no problem. If you forget in the dosing also, there is no problem. And rapid termination is possible. This is not possible in case of oral as well as parenterals. So, here we can remove the formulation from the skin and you can stop the treatment. And good option for patient who cannot take the oral medication, those patients in the comatic patients and those who cannot take the products by the oral route, geriatric patients as well as those who are patients in the vomiting and diarrhea cases, and those patients have the oral cancers, such cases we can prefer the transdermal drug delivery formulations. Now, what is the limitation here? We need to give all type of or most of the drugs in the lipidic form only. So, the limitation of transdermal drug delivery system is that here this formulation uses only with the lipophilic drugs, because the lipophilic drugs only passes the skin barriers. So, whereas if you take water soluble drug, that will not permeate through the skin. So, that is one of the major limitations. So, here you have to use the lipophilic drug, that is one of the major limitation for the treatment with the transdermal patches. But yes, here you can provide some of the lipids or some of the penetration enhancers which can overcome the limitation. Patch size limits the drug dose. So, drug must be very potent. Yes, this is true point. You need to take potent drugs so that we can put the very less amount of dose, because of the patch size is limit. So, that we need to consider, and this cannot be performed for the drugs which have the high dose. Patch adhesion can vary with the type, temperature and skin condition. So, here we have different types of the patches as well as the patient pathological as well as physiological and the biological conditions will also affect the ultimate permeation of the drug. And yes, this may leads to the skin irritation because you are keeping the patch for 24 hours, 48, and the materials with the adhesive materials may create the skin irritation as well as allergic reactions on the skin. Skin barriers may by body part, person, age effect, that will affect the drug absorption. The body parts as well as the individual and the age also, because the age of the skin will be different from the younger people to the old age people. So, definitely the stratum corneum will become a major barrier for the old age people, and the permeation is also very critical. So, these are some of the physiological and pathophysiological factors also will interfere the permeation of the formulation. So, these are some of the ideal characteristics of the transdermal drug delivery system. So, yes, if you are claiming your transdermal patch should be the ideal, so that formulation need to show the shelf life of the 2 years, and the patch size should be less than 40 centimeter square, and also dose frequency should be once a week, because the everyday is preferable for the in case of smoking cessations, but whereas when it comes for the as a drug molecule, you cannot go ahead with the daily dosage. So, once a week is preferable, like a hormone replacement therapy, and some other cases we can use a once a week, and aesthetic, that should be your transdermal patch should be clear and tan or white in the color, and the packing, that should be easy removal or release of the liner, minimal steps for the application. And skin irritation, your transdermal patch should be non-irritating and non-sensitizing. And yes, the patch completely, that should be compatible with your drugs, and that should show the maximum drug loading in your patch. So, then only it will be called as a ideal characteristics of the transdermal drug patches. And the release is very, very important, that will ultimately affect the pharmacokinetic, pharmacodynamic profile of your formulation. So, that release need to be controlled and slowly at predetermined time. So, here we will try to understand the anatomy, because while developing any type of formulation, we need to understand the anatomy of the organs. So, here we are discussing the anatomy of the human skin, because it has a limitations while during the treatment with the transdermal patches. So, we know that skin is the body largest organ, and which made up of water, proteins, fats and the minerals. And also it has a various layers, that is the structure of the skin. You can see epidermis and the dermis and the hypodermis. The outmost layer is epidermis. Again, this epidermis have the 5 different layers, that you can see stratum corneum and other stratum layers. The main critical in the transdermal patches, that is the stratum corneum, which has 15 to 20 layers of dead cells. Now, you can see here, so these are the dead cells. So, that is the one of the major problem in the permeation. So, stratum corneum is a main barrier for the drug permeation. So, when you use novel drug delivery systems or the advanced transdermal delivery systems, we can overcome the all types of the barriers which comes from the stratum corneum. So, and you know that, see the thickness of the epidermis, and it has a 15 to 20 layers of the dead cells in the stratum corneum alone. So, only lipid forms can be passed through the skin surface. So, dermis, that is the second layer, which contains the various types of connective tissues, and also which contain the collagen, also elastic tissues. So, here which loaded with the blood vessels and nerves and other type of the hair follicles and the sweat and sebaceous glands, that you can see clearly in the picture. So, this anatomy will help for the overcome the all type of the limitations which comes from the in the topical formulations. So, that is why we need to understand the anatomy as well as pathophysiology, biological barriers of the skin. So, based on that we can make in a right formulation, so that can overcome the all type of the physiological problems and physiological hurdles during the development as well as delivery. Now, here we are seeing the percutaneous absorption mechanism. So, we know that it follows the Fick's law of diffusion, that means drug moves from the high concentration to the lower concentration based on the concentration gradient that will permeate across the skin. Now, here is the first step after administration, after placing of the patch. So, your drug will release from the patch, and from that it will diffuse into the stratum corneum, and then it will permeate into the epidermis, and further it will go to the dermis, then it will reach to the systemic circulation. Then after that it will show the action. So, this is the diffusion process or percutaneous absorption followed in the transdermal patches. Now, here is the drug penetration routes across the intact skin. So, here the transdermal application will follow the 4 types of the mechanism. So, that can be further classified into 2 things. One is the transepidermal, in that we have 2 different mechanisms, and also transappendigeal, it follows the glandular also follicular mechanisms. So, we know that transcellular this will permeate the drug molecules across the cell, and here this intercellular will pass the molecules, this mechanism involved, this will the molecule move into the skin between the cells, and here also the transglandular and the sweat glands involves in the transglandular mechanism, and in the follicles will help for the absorption or permeation of the molecules from the follicles. Here you can see some theory also that will help for you. So, here the first one is transepidermal pathway, that is drug travel via stratum corneum, and the transappendigeal pathway, the drug travels via skin appendages. So, here the first route is transcellular, that is called as intracellular, drug passes through the skin, which is called corneocytes. Only hydrophilic drugs can be pass through transcellular route, whereas paracellular or intercellular, this will pass through between the skin, and here the lipophilic or fat loving molecules can follow the intercellular mechanism. And in case of transappendigeal, here we have the glands and the hair follicles that will follow the third mechanism, that is a transappendigeal pathway. And here we will see some of the barriers which are involved in the transdermal drug delivery systems. Now, you can see the skin barrier, how it looks. So, you can see the outer layer is the human epidermis, and also that you can see this, the top layer is the stratum corneum, and you can see that further is shown in the pictorial representation. Human stratum corneum bricks as well as motor, the corneocytes and the lipid matrix. Now, this further again examined and represented in the pictorial representation. You can see the lipid layers which are presented in the lamellae form, and now you can see the arrangement of that lipid layers. These are the lateral organizations, and you can see the lamellar organizations. So, these barriers, these dead cells and the combinations of this lipid layer is one of the major limitation in the transdermal drug delivery systems. Now, you can see the barriers to transdermal drug delivery. So, complex multi-layered structures, small pore size, highly hydrophobic outer layer, relatively hydrophilic inner layer. So, this completely leads to the limited permeability of the molecules through the skin. So, while designing of any type of novel transdermal drug delivery formulation, we need to consider various factors which are related to your drug as well as dosage form, and then physiological barriers of the formulation. According to that, you can create novel systems moving from conventional transdermal formulation to the advanced transdermal drug delivery systems. For simple example, microneedles are the needles which can completely bypass the stratum corneum, which already we have seen in the eye formulations or ocular drug delivery systems. So, while developing, we need to consider all these factors which are involved in the barriers. So, that need to be considered, and while designing we need to focus on the drug properties as well as we need to focus on the dosage form, and then third one is physiological or biological barriers. So, in our upcoming classes, we are going to discuss on the various types of the various factors which are involved in the development of the novel transdermal drug delivery systems. So, today we have learned what are the transdermal drug delivery systems, and also we have seen what is the importance in the therapeutic application, and also we have seen the advantages, limitations of formulation, and then we have seen the what are the ideal characteristics of transdermal drug delivery systems. Then we have seen the anatomy of the skin, and then we have seen the what are the permeation pathways, and also at the end we have seen the barriers. In our upcoming classes, we are going to discuss on the what are the factors which will influence the permeation of the drug across the skin. So, with this I am going to stop today's lecture. Thank you so much.